Hemoadsorption seems to be a key element nowadays. Although there are new things and new trends that we have to follow, hemoadsorption as a single treatment, as in combination with other major treatments, it should be, and it is, one of the basic elements against sepsis in ICU. On the basis of my personal clinical experience, of course, as a clinician, I follow the clinical picture of the patient, which is crucial. But before that, in many cases, we have followed a very significant improvement of laboratory measurements, which is a kind of a first and early message that the patients will go good. So I would say in total that the clinical approach and the clinical outcome of the patient is the major measurement, but the lab test is also a key element, especially at first. The number of sessions for hemoadsorption is something that is not steady. It depends on the patient, it depends on the disease, it depends on the method, it depends on the cartridge, it depends on the device. Surely, the thing that we have to focus is to start early, although even if you start late, it is also a severe option. And the second thing is to see how things are with the patient and discover how many sessions we are going to apply. I think that the main things that we have to focus is first early start, and secondly at least a significant amount of time for every session in order to offer the best for your patient. You don't have to worry for many hours. You have to start the session to have at least 45 minutes, 1 hour, and I think that the significant input will come. I think the two main things is time, to discover which is the best time. Although we all say that earliest is better, the time is a good element that we should clarify. And secondly is to see how much sessions we are going to use, and mainly that we have to skip the laboratory test and based on our clinical evaluation for when to start hemoadsorption. In sepsis especially, the laboratory tests are coming late and the decisions have to be done earlier. So a trial should focus on time and if I may say, the ignorance of laboratory tests. Of course, from the outcome of the patients, we can evaluate the cost-effectiveness of our therapy. If patients are getting better, then we are happy. Despite the innovations in so many sections in medicine, still sepsis is a major cause of death. So the outcome is the key. Hemoadsorption is a safe, easy and very realistic element of therapy for septics, and not only for septic patients. So don't be afraid and carry on to learn more about it.